Hi Sahaj, how are you?
I'm good, thank you. How are you?
Very well. So I am Dr. Ravi and I'll be one of your interviewers today.
Mhm.
So I was going through your application and you have a pretty decent, diverse kind of things, but I would definitely love to know how you want to describe.
Sure. Should I?
Yes, yes,
Uh,
absolutely.
Thank you. As you know, my name is Sehaj, and I belong to Amritsar, India, which is also the city of the Golden Temple. I studied at a boarding school, after which I returned to my hometown to graduate from Government Medical College, Amritsar, and be the first doctor in my family. My journey in medical school has been very rewarding. I had the honor and privilege to serve a very diverse and underserved community, which gave me a lot of gratification. Additionally, it was also, we were students when COVID struck. And during the lockdown, I had the honor of being a part of my first research project as well. In the past year, I've taken the STEP exams and traveled to the US to gain US clinical experience in both inpatient as well as outpatient settings. I enjoy Urdu poetry and I also love to do Bhangra, which is an Indian folk dance. Thank you.
Lovely. I've heard about Urdu poetry. That's a pretty unique skill to have. Um, so definitely you have a lot of other passions beside medicine itself, but I would really want to know, like, why did you specifically choose internal medicine?
Internal medicine became my choice after I had completed my internship. Having seen all departments, my interest in internal medicine grew stronger. As someone who has a thirst for knowledge, as well as I would want to be in a branch which can help me connect with the patients I treat. I believe internal medicine is the perfect marriage between these two. Additionally, I was also inspired by my doctors whom I got to learn from. They would play diverse roles ranging from outpatient duty as well as being the hospitalist for their patients. They would also teach us. And having so many diverse options to choose from is something I value highly and feel inspired that I could choose one of these roles or maybe even all three.
Great. So I'm sure, like, back in your home country, the experience is pretty different. How medicine is, or if it is not, I would definitely want your insight. Like, why do you choose to like not be in your home country, and why do you choose US?
I'd like to begin by saying that my father says that education is the best investment we can make towards our future. And coming to the US would take me closer to that goal as someone who believes that world class education in the US would help me be a great doctor. I aspire to be a doctor who has proficient academic knowledge along with principles of ethical practice. I believe US will be the place which will provide me with both these facilities. Additionally, I want to be in a practice which respects ethical principles, along with world class technology and new advancements in medicine, which I will have the opportunity to learn from and then help eventually treat my patients better.
Right. I am sure, like, having been from another country myself, there are subtle differences and it takes some time to get acclimatized. But the things that we offer you here at our program are something I feel can connect really well with what your aspirations are. So that's pretty nice to know. I had another question before I do offer the mic to you. I wanted to ask you, like, where do you see yourself in 10 years? Have you planned? Are there certain aspirations, any specific interests that excite you?
In the next 10 years, I see myself practicing as a compassionate doctor who has proficient academic knowledge, and I'm using that knowledge well to treat patients, especially in the underserved areas of the community. I do have an inclination towards more of primary care currently, but I believe as I do residency, I'll have a better idea as to what each field is like, and I would want to keep my options open.
Lovely. I think we have a lot of opportunities, especially after internal medicine at our program. So absolutely, you don't need to decide everything in the first go. And I love that you have such a charming personality, and I've also seen that you've traveled a lot, which I think definitely adds to the mix in a good way. But before I wrap up with the interview, I would love to offer you the opportunity to ask me any questions if you have any.
Yes, sure. Thank you. I'd want to know more if we have any volunteer opportunities in our hospital itself.
So basically, what we do is whenever you have your off days, and then there are certain opportunities that we provide as a program as well. So whenever you talk to the chiefs during the next session, you can always ask them that there are bi-monthly events that we participate. Obviously, it gets difficult depending upon your what rotation you are on. So not everyone can be part of those opportunities at all times. But I very genuinely believe like if like volunteership, depending upon academics or research or community outreach, whatever excites you, our residents are able to take out time for those activities. So I think if you can plan things well in advance, the amount of opportunities that you can get here, I've seen my prior residents participate and reach out to communities in big ways. They've even all gone to the immigrant areas to help a very different kind of a population. So depending upon whatever your interests are, I think you'll get a lot of opportunities in our program.
Thank you. I'm looking forward to that.
Perfect. It was lovely, lovely talking to you, Dr. Chahal. I hope to see you soon.
Yes, thank you. Thank you.
So, like you could see, this was one kind of an interview. I think about 40 to 50% of your interviews would be this comfortable, where the interviewer will make you feel comfortable, would genuinely try to have an honest conversation with you. It won't be intimidating. What you need to do in that situation is recognize, oh, this is that kind of an interview, and grab that opportunity to express as much as what you want to express. So most likely your first question, like I asked you, would be something like, tell me a little about yourself, or describe yourself to me, that I have read your CV, but what do you want to tell me about yourself? So this is something which should be very clear in your head. And then you can have certain divisions that you want to steer conversations in a certain way, like you said, like I am Sehaj. So, I mean, you can choose. If you're in a comfortable environment, you can choose to just say, like, oh, I am Sahaj. I obviously know your full name. I obviously know things about that. You don't have to narrate things which you feel are just completing your introduction, but not adding any value. Like, if you want to say, I'm from Amritsar, and then add that, oh, yes, the city of the Golden Temple. That is what I like, because then that adds value. Why did you mention Amritsar, right? Otherwise, things are in your CV. So give everything a reason to why it is there. You want to hook on to that person, right? The other thing I loved was you talked about your hobbies in your interests in your introduction. So like your Urdu poetry, or if you feel travel is an important part of you, so you can mention those things in your introduction itself, because that way you can help steer the conversation in a certain way, because you do not know if the person is actually going to ask you about your hobbies after this or not, right? If he or she is interested, he's going to like talk to you more about. The other thing I realized was when I asked you like why internal medicine, definitely there might be some certain reasons that it was always your choice, but you need to have like a crisp XYZ reason that, oh, like in your case you had, where I like patient care and I like XYZ thing, and it's a good combination of both the things. So that needs to come, like if questions like that are not prepared, then I feel like the person is not very sure. So these are the questions that you need to know answers to, which in your case you did very well. One thing that I did not anticipate or expect you to think was when I asked you, why did you choose our program? So that is something I want you to research before every interview. Like there have to be reasons like, oh, your program has these tracks, or your program is in this city, and your program is also much more active in terms of community healthcare, whatever your reason is. But you need to tell them that this is the reason that I'm applying to your program. Besides that, I think you answered the last question pretty well. Where do you see yourself in 10 years? Now, people can have different answers to that. Some people are sure that they are like, oh, I see myself probably doing a cardiology fellowship. Some people are like, I'm definitely becoming a cardiology fellow. I would say it's not problematic to mention it, but you have to remember you're applying for an internal medicine residency. So you can always say that you have to emphasize your love for internal medicine as a whole, and then definitely mention like, oh, I'm probably interested in cardiology, and that is where I see myself going in 10 years. But for the next 3 years, I'm fascinated by all of internal medicine. Like, don't come across as someone like, I'm just doing for the sake of it and I'm ultimately going to do something else. Which in your case, which was a very honest answer, which I really liked. I don't expect everyone to know what they need to do, and most people are kind of deciding what they need to do. So that was about that. Great job on that. And at the end, make sure, like in your case, you remember to ask at least one question which has to be relevant. So like in your case, you did ask a relevant question, which makes me think that you are interested enough in the program. You don't have to have a barrage of questions. Plan according to the time you have in the interview, but I would always say it's a great strategy to ask at least one question. And also, just to bring forward a few points, make sure your lighting is perfect, make sure your dressing is appropriate according to what you plan to do, and also assess by how the interviewer is dressed. Sometimes it will be a very casual interviewer, and don't let that make you casual about it. You are a candidate, so you have to be on top of your game at all times, right? But great job.